first in a series of weekly webinars that IOSH will be hosting related to managing safety, health and well-being during the coronavirus pandemic. And with all the information currently out there on COVID-19, we wanted to begin the series by inviting the global body leading the international fight back against this outbreak to talk with you. The World Health Organization, the WHO's primary role is to direct and coordinate international health within the United Nations system. And its main areas of work include health systems, non-communicable and communicable diseases, and preparedness, surveillance, and response. It's come to the fore in advising governments and organizations worldwide on tackling the outbreak. So we're delighted today to invite Director of the WHO Department of Public Health, Environment and Social Determinants of Health, Dr. Maria Neira, and Dr. Andy Ramsey, part of the Infectious Hazard Management Department at WHO. And finally, also WHO Occupational Health Team Leader, Dr. Ivanov. Before we begin though, I want to emphasize that this and the following webinars are a platform to inform and engage with safety and health professionals and others around the world with a responsibility for safety and health at work. Occupational safety and health professionals have a critical role today, more than ever, I think, in providing sound and practical advice to organizations. And now more than ever, organizations are seeking authoritative, useful, relevant advice and guidance on managing the safety and health of their workforces. So we want to support you with this regular platform for engagement, giving you the opportunity to share support and guidance on this evolving issue wherever you are in the world and whichever sector you're in. So before Dr. Ramsey and Dr. Ivanov give you their insights, may I welcome Director of the WHO Department of Public Health, Environment and Social Determinants of Health, Dr. Maria Neira, for her introduction.
Thank you so much, Andrew, and thank you, IOSH, for organizing this amazing webinar. It's quite impressive to see the moment we are talking. I'm checking the number of participants join, and we are almost 3,000, and the number is increasing. So I think this is absolutely almost revolutionary, and on a way demonstrating that when people want to get together, work together and join in forces, there are no limits, no even pandemic that will stop us for getting together and contributing to all of that. We are living on a very strange, unprecedented, probably even historical moment. At the moment we are talking in many countries around the world, and particularly I'm thinking on two countries in Europe, the two of them very, very close to my heart. They are struggling, the health professionals are struggling to respond to this massive demand created by the response to COVID-19, while at the same time they need to keep providing as well essential health services. Those health professionals in countries like Spain and Italy, they have demonstrated in response to this emergency, this crisis, that they were at the front line, no doubt. They are responding with the best of their capacity and professional attitude, but they have been infected, and they have been infected on a very high proportion of them, which is absolutely something that we need to make sure that this is not happening again, and they will have all the material and the recommendations. That's why this group is so fundamental and so critical in supporting these efforts to respond to that. No doubt that this pandemic is changing completely our way of living and developing, and hopefully we will learn something from this, and hopefully we will, after this, we will start to drive and lead a new, more sustainable and more protective, and where primary prevention will be more important, and where investments on health systems and research and all the precautionary principles and prevention activities will be supported. I'm very pleased to see that among the things that the coronavirus is changing is the way of working and the way we are responding all together. You will hear more from my colleagues, Ivan and Andy, but I would like to say that at the moment, I feel a huge responsibility on responding to the many technical questions that the people is asking us on a very pragmatic way. This is not time either for providing recommendations that are too complicated or not adapted to the fantastic demand that they are having and the critical and dramatic challenges that they are facing every day. Many countries are going into, as you know, on the lockdown, which will represent a massive, probably negative effects, probably no, for sure, on their economic and social development. And we are very much requesting countries to be prepared to protect the workers and protect their population with social protection and plans for responding to this major economic crisis that can put risk for their investments on the protection of safety and occupational health programs. So thank you again for organizing it. So happy to see that we are more than 3,000 by now and still increasing. And thank you all for being responding and on such a genuine and fantastic way, because it's, as I say, it's very much needed, and we can all contribute to face this terrible pandemic and hopefully start to prepare for the next phase after that. Thank you all. And again, thanks for inviting me.
Thank you, Dr. Nira. We're delighted to have the support of you and team members from the WHO in this collaboration with IOSH today for this webinar. It is amazing, as you say, to see how many people are joining us today, over 3,100 people and still growing. So just a reminder on housekeeping, you can use the chat facility to talk to people in our technical team about issues you may be having with technology or audio. Please use the Q&A function to prepare your questions for the panelists at the end of this session, and I'll facilitate those questions for you. So thank you, Dr. Nira. And now to Dr. Andy Ramsey from the Infectious Hazard Management Department at the WHO, the World Health Organization.
Thank you very much. Thank you, Andrew, for the introduction, and thank you to IOSH for inviting us to your amazing webinar. And I'm also fascinated to see the numbers that are coming onto this from all over the world. So I'm very happy to be here. We are in a situation that is, as Maria was saying, unprecedented. It's difficult to think that just 3 months ago we had never heard of COVID-19 and coronavirus. So I'd just like to, it's moving so fast, I'd just like to take you a little bit through what has been happening in this pandemic now. So on 31st of December 2019, the WHO was advised through the International Health Regulations process of 44 cases of an unusual pneumonia in Wuhan, in Hubei province in China. On the 7th of January, scientists in China isolated the virus, identified it as a novel coronavirus. And just 5 days later, they shared the sequence of that virus worldwide to try to get the development of some tools started. And on the 30th of January, the WHO declared the coronavirus a public health emergency of international concern. And by the 31st of January, just 1 month later, there was already close to 10,000 confirmed cases in 20 countries and 213 deaths, all of those in China. Most of the cases at that time, 9,720 of the nearly 10,000 cases were still in China at that point. 1 month later, 29th of February 2020, there was over 85,000 confirmed cases in 54 countries, and nearly 3,000 deaths in 7 countries. And one month after that, on the 31st of March, we have over 750,000 cases in 202 countries and over 36,000 deaths. So this has spread incredibly fast to nearly all the countries on the planet. The epicenter has changed from East Asia to Europe, and now increasing numbers of cases in North America. When this new virus started, we had no immunity to it. It's a new virus, so we had to assume that everybody is susceptible. We had no diagnostics, we have no drugs, we have no vaccine, and we're having to learn about it from scratch. And our knowledge is growing, but it's not complete yet. And so there are still some areas that we are investigating and trying to find out new information about this virus and this disease. So what we know about it at the moment is that it's spread by respiratory droplets. The way that this is when somebody coughs or sneezes, they will spread out some small particles of fluid from the respiratory tract that will contain viruses. These droplets are relatively large and heavy as droplets go, and they don't travel far, and they sink to the ground or to surfaces and land there. And the way that you protect yourself and protect others is, if you are coughing, to cover your nose and mouth either with a tissue or with the flex of your elbow into your sleeve. Try to keep a distance of 1 to 2 meters particularly from anybody who's coughing. And you wash your hands regularly with soap and water or with alcohol hand rub, because your hands get contaminated because they touch surfaces that the droplets have landed on. All ages are susceptible to infection, from the very young to the very old. And we know this from secondary infection studies, checking and testing contacts of known cases. But children and younger people are much less likely to become sick, to become seriously sick, or to pass away. We get a range of symptoms from very mild to severe, critical, and fatalities. The risk of getting severe infections and to dying from this disease increases with age, and particularly from 60 upwards. And there are some underlying conditions which we know predispose people to severe illness. These include hypertension, heart and lung problems, and diabetes, and people on cancer treatment, or with other forms of immunosuppression. We also know that people shed the virus very, very early in the illness. So at the time of the onset of symptoms, people are already infectious and likely for a short period before they become infectious, before they become symptomatic. So this slide here shows you this exponential increase in the spread of the disease. It took 67 days from the 31st of December to reach the first 100,000 cases. It took only 11 days to reach the second 100,000 cases, 4 days to reach the third 100,000 cases, and just 2 days to reach the fourth 100,000 cases. Reports to WHO over the past 24 hours are over 75,000 cases. So this is rapidly spreading and becoming an increasing burden in countries. So there's over 500,000 cases now, over 21,000 deaths, and the USA is currently the country with the highest number of cases, new cases globally. So people are there's a number of different scenarios that are possible in each, in different countries. Some countries have not reported a case or are just starting to report cases. And then some they have clusters of cases, and some there's widespread community transmission happening. Different health systems priorities for these, and different public health measures that can be implemented. I won't go through all of these, but you'll have this set to look at later. But it basically moves from testing and identifying cases and contact tracing and quarantining and isolating infectious cases so that you can contain the outbreak, to the situation where you are trying to implement isolation, quarantine measures, social distancing, lockdown, to try to slow the spread of this virus. And the aim of that is to flatten this curve so that you don't get a peak which overwhelms your health services, but rather has the same number of people most likely getting infected, but over a longer period. And it's important to get your information on this disease from reliable sources. There's a lot of misinformation and disinformation out there. So I've put here the addresses of web addresses of places where you can get reliable information. Thank you very much.
Super. Thank you, Dr. Ramsey, for that enlightening session. We've got lots of questions coming in, and I'll get to those at the end of the session after we hear from our next speaker. Just a reminder that this webinar is being recorded. You'll be able to access it in future to check back on the information that's been shared or anything that you've missed, and also to be able to forward it to your colleagues too. You'll receive information of that over the next few days, as well as being able to find a link on the IOSH website. Also, a lot of people coming in on chat and Q&A. You can ask questions to the panelists using the Q&A function in this webinar, and you should use the chat function to tell us only about technical issues related to the audio or sound quality on this webinar. Certainly with so many people on, there appears to be a slight lag between some of the slides and some of the audio, but hopefully that's manageable for everyone here. With nearly 4,000 people on the webinar now, it's quite an opportunity to share and learn together. So let us now move on to Dr. Ivanov, the team leader of the Occupational and Workplace Health Unit at WHO. Dr. Ivanov will share WHO's guidance and recommendations now for responding to COVID-19 in the workplace. Dr. Ivanov, please share your screen and unmute yourself.
Okay. Good afternoon, good morning, good evening, everybody. I'm Ivan Ivanov, and I'm the team leader for Occupational and Workplace Health in the World Health Organization, the headquarters in Geneva. And it's a pleasure for me to be with you. Thank you very much again to the IOSH for organizing this webinar so quickly and for engaging with global occupational safety and health community in the response to this public health crisis. With the WHO recommendations for getting your workplace ready for COVID-19, we have issued this at the end of February. So at that time, it was still about the preparing ready. Now the virus is here, the virus is at the workplace. Many workplaces have actually stopped, so we are updating also our guidance regarding the workplaces. But the basic measures for protection against the virus at the workplace is to ensure that there is a good respiratory hygiene, that there are paper tissues and even masks available for those workers who may have a runny nose for the workplaces that still work. and promote regular and thorough hand washing, provide sanitizing hand wrap, but also clean. It's not necessary to disinfect everything, but all surfaces and desks should be wiped and cleaned, and if necessary, if they're soiled, then have to be disinfected. And also the organization of teleworking, social distancing, or physical distancing measures at the workplace are very important. WHO has clearly indicated that the measures for COVID-19 should be coming from occupational health and safety officers at briefings, meetings, and information. So occupational safety and health officers in enterprises have a very important role also for education, for displaying posters, and providing occupational health services together with the local public health authorities. Now, there are certain workers who are at very high risk of coronavirus, and that depends on their contact with the general public, but also contact with objects and have been there is one guidance already prepared. Several countries have already guidance prepared for the pandemic influenza, which are quickly adapted to the COVID-19. The mode of transmission is very similar, so they can be used and adapted to this situation. How to assess the risk of workers from COVID-19? WHO has provided special also guidance for workplaces concerning risk communication and risk engagement, in particularly a guide on how to prevent and address social stigma associated with COVID-19. And there are also recommendations concerning mental health, and in particular mental health of workers, of health workers and other workers which may suffer from isolation, remote working, or may experience stress, may experience exacerbation of existing mental health disorders, or may suffer disorder, and some of them even harassment and violence. WHO also has, this is the section, I'm not going to read everything, but just to show you, that you can find on our website also the special guidance for technical guidance related to schools, workplaces, and institutions, so that you can see that our WHO has special recommendations for the accommodation sector, for prisons, for schools, for the general workplaces, and for long-term care facilities in the context of COVID-19. Occupational safety and health practitioners are frontline responders, and we say that everywhere and to everybody loud and clear, and I wanted to make it also loud and clear to you that it is your role as occupational safety and health practitioners to facilitate the access to reliable information for workers and the management, and to promote understanding of the disease and its symptoms and how it gets transmitted in a scientific way, official information, not myths, not rumors, and how to use the preventive measures, particularly respiratory etiquette, hand washing, and self-isolation in case of sickness. In addition to that, in addition to this general role, occupational safety and health practitioners also are and will be involved in assessing the risks of the workplaces that are still open, the infectious and non-infectious hazards, to develop plans for prevention, for containment, for mitigation, and when workplaces started reopening, also for the recovery. So they also have to identify if there are high-risk occupational groups and provide the necessary risk communication and advice on the preventive measures and their health surveillance. Particularly, it is necessary that occupational safety and health professionals also are able to provide measures for protecting health and safety in alternative work arrangements, such as teleworking, stage working, different arrangements, to participate in the development of business continuity plans, to assess the risks, identify, record, and follow-up of occupational exposure. And in many countries already, occupational cases with COVID-19 among health workers are considered occupational disease. So countries may start updating also their lists of occupational diseases and what is accepted as occupational exposure. WHO has specific guidance for assessing occupational exposure of health workers. Also, it is necessary to provide risk communication and engagement of workers, psychosocial support, extremely important now in the period of social isolation and physical distancing, and to collaborate with community and public health authorities. There are also knowledge with regards to occupational safety and health for workers, particularly the business continuity of essential public health public services, which include, of course, the healthcare, the food supply and retail, utilities, communications, security employees, public supply chains, different essential public services in different countries. But it is also very important to engage and collaborate with the unorganized sectors who do not have an employer or a formal leader or a formal mechanism to get information, particularly workers in the informal economy, the gig economy, the domestic workers, the migrants who continue to provide also these essential public services. We have to learn on how to do better infection control for high-risk workers and occupations, how to do risk assessment, management, and surveillance. Infection prevention and control has developed as a discipline primarily for healthcare facilities, but we are now discussing with colleagues in infection prevention and control and the global community of the occupational health community and infection prevention and control community on expanding the measures also to non-healthcare workplaces. Occupational safety measures in alternative work arrangements, and also it is possible and it is highly necessary to continue the delivery of the basic occupational health services, even in this time of crisis. And it is possible now to use teleservices, hotlines, webinars like this, applications, maybe even artificial intelligence will create for risk assessment. They created a lot of already models of how to model an infection based on having one case at your workplace, and then how you can calculate the potential spread of infection at your workplaces. In China, they're using also drones for control of workplaces and occupational health services. WHO has the information network for epidemics that my colleague Andy mentioned, and he works in that team also. And we have a specific website portal for the different stakeholders and communities, ranging from individuals, travel and tourism sector, health sector, employers and workers, faith-based organizations, large event organizers, and for countries. And the latest WHO recommendation that was yesterday was hygiene, and that WHO recommends to all countries to provide universal access to public hand hygiene stations, both for hand washing, but also for using hand sanitizer, and makes this obligatory to the entering and leaving of any public or private commercial building. So all workplaces are by this recommendation. And if you have made some plans already for Easter, maybe you have to change them and look into the resources for occupational health, for COVID-19, for occupational safety and health experts. And with this, I want to wish you to keep safe and to keep working apart but together. And we have enormous opportunities of doing that. Thank you very much.
Thank you very much for your presentation, Dr. Ivanov. I'm sorry that the sound quality wasn't so good at some points during Dr. Ivanov's presentation there. That was something to do with the Wi-Fi connection at his side, I understand. There was nothing that we could do to change the quality of that audio for you. But this webinar is being recorded. You'll receive a link over the next couple of days to access it again. You'll also find a link on the IOSH website, www.iosh.com. So you'll be able to access all of the resources again there in full at any time you wish over the next few days. So now let's have the opportunity to discuss your questions with Dr. Andy Ramsey and Dr. Ivanov. As facilitator of this webinar, I can tell you it's quite a daunting challenge to look at a Q&A box with 353 questions in already, and some questions that were submitted in advance by you too. So I'm going to try my best to get as many of those around the common themes as we can. Whilst we go through the questions, please also keep an eye on the poll we're launching through the chat facility, because your feedback on this webinar is absolutely vital for us. And let me remind you too that IOSH has its own COVID-19 resources page with advice and guidance there. You'll spot the poll coming up now asking for your feedback. So I'd ask you just please to quickly answer these 4 questions and then we'll get on with the questions and answers to the panel. All right, so over to you. This is your opportunity to put your questions to our panelists, Dr. Andy Ramsey and Dr. Ivan Ivanov from the World Health Organization. If we run out of time, which I suspect we will now with 367 questions in the queue and more coming in, then we'll review the remaining questions and share answers and related guidance in our post-webinar page that we'll put together at IOSH. Let's start with perhaps a couple of hopefully easier questions. It struck me over the last few days that we're using the phrase COVID-19 and coronavirus with the assumption that everybody understands just what these two things mean. My first question then to Dr. Ramsey and Dr. Ivanov is, are these two terms interchangeable? Do they mean exactly the same thing? What exactly does coronavirus mean and what does COVID-19 mean?
Maybe I can take this question. Coronavirus is a family of viruses, and members of that family are include the causes of common cold, and a very mild disease, of course, up to the Middle East respiratory syndrome, MERS, or the severe acute respiratory syndrome virus, SARS. So this is just another one of these coronaviruses, and the COVID-19 stands for Coronavirus Disease 19 for 2019.
Excellent. Thank you, Dr. Ramsey. There's a number of questions around distancing, social distancing, and there's some confusion around whether that should be 1 meter, 2 meters, or 3 meters. Can you just help us clarify on that, please?
I think what you need to bear in mind here is that no matter what you do, there is no zero risk. So in WHO, we say to keep at least 1 meter, which is 3 feet away. Some other organizations may add more distance to that, but it's really just a question of relative risk.
Well, let's stick with the idea of relative risk and this idea of protection too. There's a lot of questions in our group today and in advance around what PPE might be suitable. As I look out of my window here, I can see people walking around in the street wearing face masks of different shapes, sizes, kinds and colors, including some that I recognize from workplaces, others that might be suitable in a joinery shop, and people wearing scarves and snoods wrapped around their noses and mouths. What are your thoughts on the use of masks and face protections broadly? Should everybody be using them now, or only if we're confirmed as being infected?
Maybe I could take this one again, Ivan, if that's okay. So the WHO advice at present is that you should wear, that the people who should wear face masks are people who are sick, so that it helps to contain the virus and they don't spread it so much. people who are caring for people with coronavirus, perhaps at home, and healthcare workers. At present, WHO does not recommend face masks for general public if you're well.
Thank you. Let's kind of extend that question into the workplace, if I may. What PPE is suitable for people who need to work in small teams? For example, engineering technicians or waste and refuse handling teams, or those that interact with members of the public. This morning, for example, I just had an Amazon delivery of some books to me and had someone in pretty close contact with me at that point. What's the advice here?
Perhaps let Ivan answer the more workplace related question, but I think generally with deliveries, and it's the same, I had some takeaway food delivered the other night, and the best way to do that is to put a note on your door to ask the delivery driver to leave it there and ring the door and step back. Thank you.
Yeah, let's ask the question then to Dr. Ivanov to extend it into the idea of workplace. What PPE is suitable in the workplace, Ivan, for people that need to work in small teams, in factories or in engineering teams, for example, or in waste and refuse handling, perhaps?
Thank you very much. That's an interesting question, and this is exactly what we're currently discussing, the extension of the recommendations for the use of PPE also to non-healthcare workplaces. There is certainly there is a difference between the medical masks and the other just tissue masks that are being used. And we are actually currently, we are not very, very inclined of recommending a heavy use of masks, because there are a lot of scientific data that show that masks themselves become an agent of infection. They have to be changed regularly, and they can become an agent of infection. So if physical distancing is not available, is not possible, then there should be an alternative work organization.
So I want to push just a little bit on that. So you're advocating no need to use masks ordinarily. If there is a requirement in a workplace for people to work in close proximity, your advice is not to do that, but instead to find alternative work and not to put people in close proximity.
First of all, we experience a global shortage of medical masks. And the medical masks are needed for health workers and for people who are sick. They have to wear medical masks. Mm-hmm. People who are not sick do not have to wear medical masks. We're considering for them alternative arrangements.
I think another thing that, if I could chip in here, Ivan, Andrew, is that all of these measures are complementary to each other. And so another measure which should be in place when COVID-19 is spreading in a community is that you don't go to work if you're not feeling well. Even if you have mild symptoms, you should be staying at home. And so this is another protection for workers, is that people who are sick shouldn't be at work.
Thanks, Andy. That's a good reminder, isn't it? There's some questions in around sanitizing, hand sanitizing, for example. Why is it only obligatory? Why is it only voluntary to use hand sanitizing stations when leaving or entering public buildings? Why should we not push towards mandatory use of everybody sanitizing hands whenever they come in and out of public places, including the workplace now?
Let me take this question. Maybe you have seen on my slides the WHO recommendations issued yesterday to all countries to compulsorily install public hand hygiene stations at public transport and all the entries and exits of public and commercial buildings. And this includes either hand washing stations or hand sanitizers.
There's been a shortage of products around the world, not just in terms of masks, but sanitizing products too. In the absence of sanitizer or hot running water, The question here from a member of the audience asks, would a single bowl of disinfectant or detergent be acceptable for multiple users?
WHO has also in our website, and then we can share also the exact link to that. We have also issued recommendations on how people can prepare, or how businesses can prepare their own hand sanitizers.
Thank you. I'm going to continue on this idea of spreading in the workplace. Can COVID-19 virus spread via building heating, cooling, and ventilation systems?
No, it can't.
Yeah. Maybe I could just give a little bit more to that to reassure people.
Go ahead, Andy.
Thank you, Ivan. And as I said before, this disease is spread by droplets, respiratory droplets, when somebody coughs or sneezes. And these are quite heavy. They sink to the ground or onto surfaces very, very quickly, and they don't travel far. And so they don't hang in the air enough to be taken into ventilation systems. Even in hospital rooms where there have been COVID-19 patients and there's been extensive viral contamination of all the surfaces and floors and walls and windows, and the air samples have always been negative. So we think this is not a likely transmission route.
Thank you. That's helpful. In our discussions this morning, we were talking about people that were at higher risk of exposure and threat to the coronavirus. And I wondered if there's any specific recommendations for pregnant workers, not necessarily just for women working in health sectors, but also in other workplaces, for example, in supermarkets or the cleaning sector or any other industry. Pregnant workers, something in particular that we should be thinking about for this group?
Well, we have information on this. There's information coming in all the time, but from what we know at the moment, women who are pregnant are not at more risk of catching the infection, and they're not at more risk of serious disease. There does not seem to be a greater risk of miscarriage during that, and to date there have not been. Like this changes all the time, but we don't think that mother-to-child transmission is a serious problem at the moment.
Thank you. There's a couple of questions here around the idea of being extremely vulnerable, and let me try to pull these together into one question for you. So, how do we determine whether someone is fit for work if they're in the extremely vulnerable category, but have not yet received a letter, and their condition may not yet be on the list of extremely vulnerable health conditions?
Well, this is exactly the role of the occupational safety and health professionals in occupational medicine to assess the situation and the likelihood of exposure with the virus and the individual medical status of the worker, and they can make recommendations.
Thank you, Ivan. There's a question just coming from Elshan Husanov that's linking quite nicely to this. How frequently should the workplace be disinfected at the moment? Is this an additional option that can be helpful to prevent spread?
That certainly would depend on how the workplace is used and what is the likelihood of the workplace to become contaminated. If the workplace is being used and there are a lot of people, it should be disinfected even at least 2 times a day, should be cleaned. Even the regular detergent is also deactivating the virus. So it is necessary that workplaces are cleaned. And how often, that would depend on how often they are used.
Right, thank you. So I guess that's in line with the guidance on personal hygiene, that we should all be increasing our own personal hygiene and hand washing, and then the same goes for workplaces too. What about asymptomatic people? What about their carrying and transmission? How do we reduce the risk when people are asymptomatic?
Maybe I could take this one.
Andy, go ahead.
Thank you. Okay, so as I said, we're still learning about this illness and this virus. What is becoming clear in recent weeks is that some people, when they get the COVID-19 test, do not have symptoms. But we must remember that symptoms are something that are perceived by people, and somebody's perception of being ill is not the same as somebody else's perception of being ill. And so clearly there are people who have very mild illness, some people who say that they don't feel any symptoms of being unwell, but their test is positive. How common that is, we do not know yet, and we won't know this until we can get a test that tells people whether people have had the illness or not, whether they may have been ill during that time. And so we don't know how common it is, but of the cases that we have picked up, more than 70% of these people then go on to get symptoms. So we think that there are not as many asymptomatic people, that's people who don't have symptoms for their whole infection. There's not as many of them as there are of people who perhaps are shedding virus before they develop symptoms.
Thank you. Andy, you mentioned tests there. There's certainly a lot of questions around tests, test kits and testing process generally. Could you give us some broad guidelines on where we should be with testing? Should workplaces be conducting mandatory tests from now on everyone entering the workplace? Is there a duty of care on employers to be testing people? What thoughts do you have here?
WHO does not recommend testing of people which have no symptoms, which have no risks. So it is not necessary. And then introducing mandatory tests certainly will reduce the ability of the health system actually to really test those who are sick and those who are infected. So this is very important. Though WHO recommends testing, but it is concerning contacts. It is concerning people with symptoms, people with disease. So this is where WHO recommends testing.
Thank you, Ivan.
I could also add something else there about tests, Andrew, is that tests are still being evaluated. So groups or organizations like the Food and Drug Administration in the US have given some emergency use authorizations for a number of tests, and evaluations are still continuing on these. And these are tests that detect nucleic acids, PCR tests. They're quite complex tests. You will see a lot of rapid tests on the internet and so on, and these certainly will not have been evaluated properly at this point. So you have to be careful about wanting to buy tests and use them. Thank you.
That's a good caution. Aligned to the questions that are coming in around tests and testing, some questions around key and essential workers. And I wonder whether we might just begin that part of the questions by thinking about what actually are key workers or essential workers.
This is a very important question, and actually, I would like to invite this audience to share with IOSH and then IOSH with WHO the experience that people in the field have about non-healthcare workplaces, and what experience and what recommendations actually are there in countries about protecting of these essential public service workers. They can be different, but most essential, of course, are the healthcare workers, but also the food supply and food retail, particularly the retail where the workers can come in contact with the public. This is also the garbage collection and the utilities, the water, the sanitation, the police and security, and public transport. Of course, some countries have added also the banking to the essential services, but many bankings are also being done being done online, and there is no contact with the public. So it is up to the IOSH professionals actually to assess the risks of coming in contact with the virus, with the public, with unrecognized or cases that may be symptomatic, or coming into contact with contaminated surfaces and contaminated objects.
Thank you, Ivan. Your guidance previously when I asked questions around mask use was that we don't need to be encouraging everybody to wear masks. Is that still the same for key or essential workers, that they shouldn't be wearing masks unless they have an infection, or does that change now?
We will issue recommendations about that, about the essential workers.
And where will we find that information, please?
It will be on the websites that I shared on my presentation. We'll add this recommendations for essential public workers.
Excellent. Thank you very much. And we'll publish that that web link and all the other web links that we've been mentioning in this webinar at the end of this webinar, so you'll have access to all of those directly. We're coming towards the end of the time that we've allocated, just a few minutes left before we go. So a couple of questions as we think forward. Jacob van der Westerhuizen in South Africa is saying, we're currently in lockdown and we're bound to go back to normal on the 17th of April. How would we control the spread of the virus among our construction industry, where employees are forced to work in close proximity to one another due to the nature of the work at hand? What are your guidances here, please, Andy and Ivan, on getting back to work and how we keep control of the virus?
That certainly will require taking measures. If construction projects are not considered essential, they may be also stopped, or they may find alternative organizations. Some companies started the so-called staged work, when people do not come at work, all of them at the same time, but they come on stages, and then to ensure that there is physical distancing also in the workplace. So all these recommendations, they're public health recommendations, and it is up to the occupational safety and health professionals to translate these recommendations into actions at the workplace based on the specific risk and the specific situation and the technology used at the workplace.
Thank you. Two questions then remaining, if I may. I've got nearly 800 still in my list to tackle. We'll answer those remotely and then post directly online with some more guidance. But last two questions, please. Will COVID-19 ever end, or will we see some kind of circular repeating pattern of this virus for many years to come?
I can answer that because it's quite a quick answer, and that is we don't know.
Thank you. I suspected that may well be the answer. Well, let me try to give you an easier one then to finish. You have 3,100 IOSH professionals on this call right now from right around the world. What, Dr. Ramsey and Dr. Ivanov, do you think IOSH practitioners can be doing to share and support right now during the COVID-19 pandemic?
First of all, I already made that call. If the IOSH practitioners can share information or recommendations about the essential public service workers, what their countries issued or what their companies issued about these workers, to share with us the recommendations, it will be extremely useful, and we need that urgently because we have to prepare next week. We have to already to prepare global recommendations. So we are looking actively into the evidence that published in the journal articles. We're discussing with occupational health experts, but what comes from the ground will be extremely, extremely enlightening. So I encourage, if IOSH has some mechanism to collect that information from its members and to bring this to our attention, it will be very, very valuable contribution.
Thank you, Ivan. As president of the world's biggest organization for IOSH professionals, I know that it's a community of practice that wants to share. The practitioners that are on this call are all absolutely committed to doing their part locally, nationally, and globally in halting the spread of this virus. There will be lots of people on this call that have some great ideas and best practices that they'll be keen to share too. I'm not yet sure how we collate those best practices from people on this call and bring them together and share them with WHO. But I offer you my commitment to explore how we do that. And perhaps with the team at IOSH, we'll work out how we ask the people that are on this webinar today to share their best practices. So please watch out for the follow-up from this webinar, looking for your support and your suggestions too.
We would appreciate that. That's excellent.
Thank you. So then, as we draw towards the end, let me just thank you for participating today. We had over 3,500 people on this webinar, which is an extraordinary number of people. Thank you very much for making time to listen in, and special thanks to the World Health Organization's Dr. Maria Neira, Dr. Andy Ramsey, and Dr. Ivan Ivanov, and all of you who joined us today for the webinar, wherever you are in the world. We'll be sending you all a link to the recording via email, so please look out for it in your inbox, and you can access the post-webinar resources on the link that's showing on your screen right now. In the meantime, as I mentioned earlier, remember that this is the first of a series of webinars that will take place over the coming weeks. So keep an eye on IOSH channels for details on the next webinar, which will be next week, 12:30 p.m. UK time, on Thursday, April 9th, where we'll be discussing mental health and well-being for remote workers. Thank you all for joining us today. Please be well, stay safe, and take care of yourselves and each other. Thank you again for joining. Bye-bye for now.